My name's Cathryn Hoy, and I am a registered nurse, along with some of my first Vice President, Angela Prio-Cannon, and DJ Sanderson. We're all registered nurses. And I'm also the very proud president of the Ontario Nurses Association. Believe it or not, we represent 68,000 frontline nurses, healthcare professionals, and 18,000 nursing students, which we desperately need. I just want to thank you for the opportunity to speak to you about the true realities of our healthcare system and really the urgent need for change. What we have experienced on the front lines of healthcare over the past few years is, to be honest, is horrific. Everyone in Ontario is set to pay the price for the failures of the Ford government and the failures of successive governments. Decades, it is shame, decades and decades of underfunding have left Ontario at least 22,000 nurses short. Well, that's the number that they say, but I honestly would say it's closer to 30,000 now. And that situation is becoming worse each and every day. For frontline nurses and healthcare workers, this has stretched them honestly to the breaking point. They are overworked, they're burnt out, and they're constantly fearful that our patients, residents, and clients are not getting the care that they need and they deserve. And for Ontarians, and I want you to remember, when I say Ontarians, that's each and every one of you and all your family members at home. It means canceled surgeries and procedures. It means less care for residents and clients in long-term care homes and in our communities. Can you imagine that? Our seniors at home with even less care than they're getting now. That's right, they're not disposable. This disaster could have been prevented had the Ford government just listened to frontline workers and acted upon our advice. But instead, Doug Ford attacked nurses' wages and our rights. Bill 124 eroded nurses' wages during a deep pandemic. Bill 195 suspended our basic rights. And what Bill 124 also did was it attacked a female-dominated profession. It gave employers the ability to change schedules on a whim, leaving nurses scrambling to rearrange childcare in their lives. Remember, I said female-dominated. We need you to come in tomorrow. Figure it out. That's not how life works. Frontline nurses and healthcare professionals are completely overwhelmed, and they do not feel that they're supported. No wonders we're seeing thousands of nurses leaving the profession altogether. And why? Because of impossible working conditions made worse by Ford's disrespect. It's not right and it's not fair. And now Doug Ford is talking about expanding private health care. We all know this will only drain resources from our public system. Where are the people going to come from to work all the private healthcare facilities he wants? And it will do nothing but threaten access for those who can't afford to jump the line. As the government tries to put the pandemic behind them with the introduction of Bill 106, they continue to miss the mark on implementing key measures and recommendations that will protect our workplaces, healthcare, and communities. This is why, as we approach the provincial election, nurses have an urgent message. We have an urgent message for all Ontarians. Make your vote count. Vote for public health care. We must end the nursing shortage by repealing Bill 124 and investing in retention and recruitment. We must protect public health care by funding our hospitals properly and keeping home and community care public. And we must phase out for-profit long-term care. and issue no new bad licenses for profit homes. It's sad through the pandemic that we've only seen profits rise in for-profit homes. Shame on them for that. Have we not learned anything from the US system where people lose their homes or have to declare bankruptcy to save their own life or save the life of their loved ones because it's a private healthcare system? So I'm going to remind you, everyone here, on June 2nd, elect a government that doesn't allow a tiered healthcare system. Why should having money allow someone to have more rights than anyone else? It shouldn't. Why should money determine your health outcome, whether you could live or die? On June 2nd, let's elect a government we can trust to support nurses and rebuild the public healthcare system.